Here we are beginning. So this is the section, and I'll try to look at both PowerPoints, but this is the one that had all that information about chemical methods of control. And there's a lot, it doesn't take that terribly long to do, but there's a lot to do with it, okay? And so really, to me, the whole idea of this first slide, and that's what we were talking about before, for the folks who were here, there's sterilants and there's not, whether it's physical or chemical, a lot of things can be sterilants and a lot of things, depending on the circumstances. With physical methods, it's radiation, but what kind, for how long, the same thing for dry heat or moist heat. When we come to chemicals, same deal. Some of them are absolutely sterilants, but most of them, it depends on how they're utilized, whether or not they sterilize. So, and really the way, this is what I sent when I sent that recording to you yesterday, if you had a chance to listen to it or not, even before we had started this unit, is more or less that I do it by categories. It's because the trade names vary, products vary. So you may use, if you work at UPMC, you may see one that has this name, or because I mean, by and large, most generic products are what we utilize because of cost. When you start to get into a clinical environment, a hospital environment, money matters. So you're going to try something that can do the job, but you don't have to play brand name prices. You're not going to see them utilizing label betadine. Maybe in some areas there will be, but most of the time you're going to be using some generic substitution, and that's fine. This way we substitute generic pharmaceuticals unless they're otherwise directed to do those things. I mean, when I prescribed, there were things I liked. I wanted the brand, and other ones I didn't, and there's a whole lot. It comes sort of experiential. So nevertheless, the only thing that's important here is it a sterilant? Does it have the capability? And we do call them spore size because, again, if you get the endospores, you get them all. And so these are typically, when we look at these heat-sensitive critical instruments. And what's interesting, when things are categorized as disinfectants or sterilants, okay, typically they have environmental implications. So they're under the auspices. And this is important, again, documentation-wise, who's asking you questions. If you get into an environment where there's surveyors or inspectors, they're under the auspices of the Environmental Protection Agency. Antiseptics, which are designed to be used on living things, are under the auspices of the FDA, Food and Drug Administration. Unless those rules have changed, and I think they have not. So it's all about these different things, and if you don't use them appropriately, they don't work. So you learn about wiggle room, but there's not a lot of wiggle room in certain things. And maybe the single most important bullet here, making sure you remove anything that's on there gets in the way. It just does. So none of these are effective because theoretically and actually they block the ability of the penetration of most of these agents, any kind of foreign material. And when you're dealing with biological material, it's a pain. It hardens, it crusts. It's the same thing as the dishwasher. It's like when you get eggs or melted cheese on, so you had a cheese omelet, ugh. If you don't get that, you got to almost pick that stuff off to get rid of it. Okay. So voila. It's the old saying, if there was a perfect surgical procedure, we would all use it. If there's a perfect way of doing things, if there's a perfect medicine, we would all use it. If there was a perfect germicide, we'd all use it. There's not, because they don't all have that. So how toxic is it? Is something, and this is where the environmental concern is so important. Think about using this stuff in a hospital. If you're using agents that smell, and you fill with a hospital with people with respiratory, that's, as I'm fond of saying, that's no bueno. Not very good. A lot of hospitals, depending on who sponsors them, big donors, they will make them environmentally friendly. They'll use these advanced, you start looking at these types of things, these, safer products to be used, but we would, things that are environmentally friendly. Okay. So there's a lot of that, and they're perfectly good, but they're just very expensive. And if you have someone who's willing to foot the bill to use environmentally friendly products, they will do something. So all of that. So we have to look at the toxicity based on cost effectiveness and overall effectiveness. There are some things that work, and I'll give you an example when we get there of organic material. The trouble is, some of these have their own subsets of problems. They work on organic material. Typically, they're fairly strong. Some things you just can't really use liquids. That's a perfect example. Residues, when we talk about bleach, when we talk about aldehydes, they leave a residue. When you touch them, it doesn't feel good. You irritate somebody's skin, and now you have a secondary problem that you don't need to have. And then cost and availability, and a lot of these things we use, if you did not know, concentrate. The first thing we pretty much talk about is aldehydes. I use cold liquid sterilization with aldehydes. Tons of us did. Because we could let it sit in what we call a barred Parker tray. That's one of those glass trays, and you can lift out the metal, and the liquid will drip out. You'll see them. You probably saw something like that in a dental office. And effectively, that material, the way we would get it, we'd have to put a new one in every day because their potency only lasts for roughly 24 hours. And interestingly, they were all concentrated. So you get sterile water or something like that. It's okay, we weren't talking about you. We needed me. I hate to interrupt folks' sleep cycle. So understand that the way that it works is you have to really appreciate, you have limited storage space in a lot, particularly this may apply more to offices than hospitals, but hospitals too. Okay, and basically how shelf stable it is, if it's the stuff concentrated. And you see a lot of these things look like that. In a sense, sunlight is a problem. There's a lot of things you use in your home that you don't want to release to sun. You don't see, think of the things you don't see in clear bottles or clear plastic containers. I mean, start with one that you probably have at home. Typically, if you're using avocado oil or extra virgin olive oil, that does not come in a see-through plastic. And the first thing, keep it in a cool, dark place. The sun will start to cause it to deteriorate. So if you want it to last a long time, just look in the store for things like that. Bleach, perfect example. And the environmental risks. And that means also for disposal. So there's all, and we look at them based on their categories. And this will be the summary page you'll see at the end of it. Start eating alcohol, right there. Okay. All that is alcohol in a gel-like. That's the hand sanitizers that are ubiquitous. They're everywhere. So, and they're typically around 70% isopropyl alcohol for the most part. That's because it's relatively inexpensive. Ethanol or ethyl alcohol is a little bit more expensive. We use that in the lab to a certain extent. There's a lot of times when we use 95% ethanol that is there. And as you can see, kills vegetative bacteria and fungi. Nothing special about that. Naked viruses and endospores, forget it. So why do we use it? It's the best part about it and the worst part about it are the same thing. It evaporates rapidly. It's environmentally friendly. We don't have to worry about it. Think of what happens for years when a nurse was going from between room to room. You'd leave the room, on your way out the door, you'd wash your hands. And now you got the potential you're going to drip on the floor. We all do periodically. It's not that easy, particularly when you're in a hurry. Now you've created a fall risk. Now you got that paper towel. What am I going to do with it that you're going to use? And so effectively, and understand that impacts a lot of different things. So people sometimes, they might skip that step. So for most instances, when you get into contact with somebody, and what does contact mean? It doesn't necessarily mean direct. You can walk in and say, how are you doing to somebody, and you still should do hand care. A friend of mine who's an infectious disease physician, years ago, was able to reduce the rate at Butler Memorial Hospital, where he was, the lead in infectious diseases, significantly, by about half, by instituting certain safe procedures. He drew a red line around a patient's bed. So typically there's one patient to a room, sometimes there were two. If you crossed that red line, you had to do hand care. So it didn't mean you had to literally touch, interact, change your dressing, or anything like that. And at that point, you had to do some kind of hand care. People don't realize that you don't have to be physically in contact. If you're that kind of, if they're coughing and you're within 3 to 4 feet of them, the risk is going to get on your hands, and that may get on you, or maybe on somebody else, or get on your clothing. What you have to do, hand care. And it's amazing, he instituted all of those things. And the single most important thing was he had to make sure that not only, he didn't have to tell the staff to do it. The people bringing in the trays, the people cleaning the rooms, they're scared. There's sick people in there, what's going to happen to me? In order to make sure that the professional staff read that as RNs and physicians, you had to get the directors of nursing, the nurse in charge of the floor, regional unit managers, you had to get the chief of medical staff. The doctors don't do it, nurses don't do it. He said, you lead from the front. Remember that 2-word definition of leadership? Follow me. That's how it works. And I urge you to remember that, because you're going to have people under you, depending on wherever you go in your lives. Most likely you're going to have people who are subordinate to you. And subordinate is a poor term, I think. It doesn't mean you're necessarily better. It means that you have to show them what to do. And it works remarkably well. I mean, I think there's a whole lot to that. Believe me, I have a son who's an authority on that whole leadership thing. And he's got, the folks under him, when you're in charge of a ship that has 96 missiles and a whole lot, and literally 400 people you're responsible for their lives, you learn how to delegate authority. They may not like you, but they'll do the work for you, because they know if they don't, there's a problem. I mean, you don't want to intimidate, but there's a way to do it and encourage and interact with the program. Enough said. I don't care what it does. Basically, it works on membranes. You add to nature's proteins. But the single best thing is the single worst thing. It evaporates quickly. It evaporates quickly. So if you don't have somebody who has C. diff or some specific condition where it requires hand care, and C. diff is certainly the poster child for this, because it's endospore based, then you do need the mechanical action of washing your hands. It's fine. You can use the hand sanitizer after that. That's fine too. But it's so easy, because it's always easy. You put it in there, but by the time you get to the next patient, it evaporates, rinse and repeat the same thing. Just do it over and over again. That's the good news. The bad news is it evaporates quickly. It's not really doing a whole lot, but getting rid of these surface vegetative. So it's fine. When we hear the term tincture, which I will be using shortly, by and large, everything we utilize is a solution. It's dissolved more than 50% water. Scientifically, a tincture is something that's more than 50% alcohol. Some things we have to dissolve in alcohol because they're not as soluble in water. So don't let the word tincture fool you. It just means it's dissolved in something that's mostly alcohol versus a solution, which is mostly water. No big deal. Aldehydes. This is the one I used, glutaraldehyde. Now they're using one that is not as efficient and really isn't classified as a steroid called this ortho, however you pronounce it, orthopaldehyde is the way I have it. Here we get to our first little side nugget that's so important. This is the time where we discuss vaccines, and there's no more relevant time. I sat here from when early in the course, when we talked about resurgent diseases. I gave you 2 examples, tuberculosis and measles. Tuberculosis, a lot of factors. Measles, vaccine laxity. What are we seeing now? Measles outbreaks in a lot of different areas. People who thought 2 things are absolutely wrong. Oh, the measles are gone. Heck no, it's the most contagious disease we know of. For the measles immunizations, guess what? 99% of people got the measles. If you think that that virus magically disappeared, no. It happened to have a relatively efficient vaccine. The problem with vaccines is not the vaccine, it's the preservative. And the problem with the preservatives, there's a number of preservatives that are by definition toxins. They're nasty poisons. They stop spoilage organisms, they kill them. The question is, what do they do to us? And moreover, since we use most of these vaccines in little kids, in babies, okay, what's the impact on them vis-a-vis particularly their nervous system, which is not developed? That's the whole idea of this mysterious, is it a link or is it not, with autism. I'll tell you 2 things. They have never linked certain of these preservatives, and the one we're going to talk about is called thimerosal, which is a mercuric compound with autism. The counter to that, they have never proven that there's not a link. The fact that there isn't a link doesn't mean there's not a link. Okay, it only proves that we don't have a statistically significant event. A study that has conclusively proven there's a link. We haven't had a study that's conclusively proven there's not a link. Okay, understand that there's a lot of we don't know, but we do know certain things about these. They are toxins, and there's no reason with the advances in pharmaceutical science that they can't make a vaccine that's suitable. Just moreover, they've removed the thimerosal for vaccines for people, for children under 6 years old. What does that tell you? I mean, it tells you they're worried, like anything, that this could be a major problem. And this magical thing that pharmaceutical companies have, being can't be sued, might very well get overturned because of it. So, I mean, there's a lot to this. The first one of these, how they used to preserve them, formaldehyde. What do we do with formaldehyde historically? Historically, in the operating room, we put specimens that we remove from surgery, put them in formaldehyde to preserve them, and they go to the pathologist. They can be what we call sectioned and look at microscopically, period. Now, I don't know about you, that stuff is nasty. We used to get items in the reason they're that hood, and we don't have to use it that much anymore, when you would get specimens to dissect in anatomy and physiology, they're packed in formaldehyde. It's so bad now, if you don't use that under the hood, it's absolutely intolerable. Respiratory problems. So that's why the formaldehyde isn't used, but it used to be used in vaccines. Get that. Glutaraldehyde was what I used. It became as 2%. It was very, very well used. Like I said, it was a concentrated form. We dissolved it in water. It loses its potency in 24 hours for my staff. First, if we start patients at 9, at 8:30, they're changing out all of those cold sterilized. They were sterilized overnight. We're going to put new ones in. Those solutions went. There's a whole series of things you do in an office or you do in an outpatient clinic. And sometimes that's why I'm telling you might be responsible. And yeah, it's nasty, so you got to rinse it. So they come out of that basin, we have gloves on, they clean it off with distilled water or deionized water, or wipe them off with alcohol because it evaporates so quickly, lay it out on some type of sterile towel, and I come in and see patients. That's how it works. So this one impacts the skin. Formalin, 37% solution, so it's more than a third of its actual formaldehyde. Inactivated viruses for vaccines. Don't use them anymore. Probable carcinogen. I don't know, maybe you don't. I have an issue with injecting that into babies. I just do. Call me silly. I mean, you can tell you're getting my spin on this. Okay? We need vaccines, because you see what happens when people are reluctant because they've heard all this stuff. You did not know, and I commented on this in the review video, the review recording. The whole thimerosal thing that came out in the late 1990s in England was a study that alarmed everybody, saying, oh, there's this major link between autism and mercuric compounds and thimerosal. It was terrible research. It was flawed. The British Medical Journal, prestigious journal, had to turn around and say, we are sorry. We didn't know this guy was a you-know-what, okay? And this terrible research, and we're sorry. It was a mistake to publish it. Medical journals don't do that unless something very serious. But people latched onto that, and all of a sudden, oh my God. And anecdotally, you're gonna have a lot of people who will tell you, my kids were fine, and then all of a sudden they got their immunizations, and now the reality is there a statistical increase? Yeah. Do we diagnose more of it? Are certain behaviors now viewed as autistic that weren't? There's a whole lot, and I am no authority on this. But I will tell you, a lot of people the word would be distrust for those kinds of things. And you hear it, and that just made this fulminate, made this almost explode. So the fact they still latch on to that, even though it's flawed research, doesn't mean there wasn't some truth to what was going on, because there's been an increase, at least in the diagnosis that are there. So all that's coming to a head, and that's aldehydes. This is chlorhexidine. It's called by guanides. So you're going, I commented on this in the recording, you're going to UPMC. okay? And you're going to do a program through there. If you look at what the soap that they have in those sinks, chlorhexidine-based soaps. Those are Hibiclens or Hexaclens. If you go to the dentist and you have some procedure done, they want you to use a mouthwash, it's going to be 2% chlorhexidine. It's on catheters. It stays on the skin, it stays on mucous membranes, it doesn't irritate. Is it a wonderful product? It's strictly an antiseptic. The beauty of it, we use it for surgical scrubbing. It's one of those whose power is unleashed with soap. So when you scrub surgically, and I said, if you're not in my lab, you're welcome to come in when we do the hand washing experiment, because I'll demonstrate surgical scrubbing, and you have your choice. You can use betadine soap in the hospital. I'll have sleeves of that, and then I'll have chlorhexidine-based ones. The betadine is sort of a brownish color, which iodines are. The way this is, it's red. I don't know whether they make it red intentionally or that's just the way it is. So it has like a white to pinkish, because you know the soap is more white. The the chlorhexidine is pink or red in color, and the mixture kind of gets this sort of pink, white pink kind of foam. And it's excellent. I mean, it's my favorite product. And we're going to utilize that in the hand washing experiment that we do in the laboratory. Just commenting on it. So it has really been, and for years, it was too expensive to use. And eventually, UPMC switched. Every UPMC hospital. I'm curious. I would go in there, and they would have standard antibacterial soap. And all of a sudden, one time I went in there with someone I knew. I think either my ex or one of my kids was in the emergency room, and I'm looking in between the sinks over at St. Margaret's. Guess what? Chlorhexidine. That's a big message, because, ladies and gentlemen, UPMC is the 800-pound gorilla. They're giant. If they switch, everybody switches. Then it becomes something that becomes, quote, a term you're going to become very familiar with called the standard of care. Because the question nobody wants to have asked in a deposition or in a courtroom is, why weren't you using chlorhexidine? Isn't that better? You didn't have that? Really? And all of a sudden, you know, the last thing anybody wants, that's a lawsuit looking to happen. Poison gas. Next time you open a needle, open a syringe, open a pack of sterile gauze that are individually packed that you went and bought at Giant Eagle, at Walmart, or wherever. The next time you open that sterile Q-tip with that white paper, a pack of gloves, a gown, if you're learning how to scrub and how to don gloves and how to don gowns, and there's a method to all of this, which I'm happy to show you at some juncture. Guess what? Poison gas. Because they are heat and moisture. Most of those products are made out of various kinds of plastics and vinyl. They're very heat sensitive. Moisture would be problematic. They're packed in a permeable paper that's sealed. They're stacked in a room, probably not this big, but maybe a room maybe half the size of the one we typically have lecture in. And effectively, it's a gas chamber. And they fill it with poison gas for X amount of hours, and then they basically withdraw the gas so people can come in and take care of it, and they have to store it in such a way and dispose of it in such a way. That's one of the problems with it. So you can see one of the problems: explosive, toxic, and potentially carcinogenic, and it has to be eliminated in such a way. And so those plastic dishes, just look in one of the cabinets in the micro lab on the side when you walk in the door to the right, you see all those are all poison gas. Implantable devices like artificial joints, poison gas. So understand how important. We used to have that. We used to have a chamber called a gas clave. I could have purchased one when I started in practice. That was 1979. But we chose to get a regular autoclave because you had like a little cartridge. And then they all of a sudden figured out, whoa, all this stuff, that was a problem. So that changed everything. The name is ethylene oxide. It's a category unto itself. It's used extensively, as you could tell. The two most important agents, pretty much, that I can think of, most commonly used at home and in the hospital, are in the same category. And they're in the same place. They're halogens. Remember halogens, right up there in where's my periodic table? Remember fluoride, iodine, chloride, bromide, all those. Halogens are toxic. Okay, we fluoridate the water. Not commenting on it here. We can. I said in that review, we used to use bromide tablets for our. We have like a little, like a mini hot tub sunk into our deck for 4 people. Comfortably fits 2. The dog is very big. He likes to get. He's a spa dog. Your dog doesn't get in the hot tub with you? Nevertheless, notice the white opaque bottle. Any kind of, whether you buy it at Walmart or you buy it here, they're going to come in that bottle. It's a sterilant. When used appropriately, we typically use it as a disinfectant because to use it as a sterilant is going to take hours, minimum of 3, as many as 12 hours that are there. It's very caustic. It's nasty to breathe. You take it and you dilute it. This is something I'm sure they don't do in our micro lab. Roughly, if you took, 3 or 4 ounces of this and took a gallon of deionized water, that's fine. The reality is, I'm not making a big deal of it for the lab, those should be changed out every 24 hours. They lose a sufficient amount of their potency, just like the aldehydes do. So we use it in very low levels, and water treatment facilities use things like ultraviolet light. They use chlorine. They use filtration systems. There's a ton. Water, if you take the environmental science course, they used to do a field trip down to one of the water treatment facilities. It is fascinating. Okay, so as you can see, some things do survive. So there's you have to use a variety of different methods. Yes, it reacts with organic compounds that are in the water. So, and yes, there's problems with it. And we can even use a gaseous form, this chlorine dioxide. But typically, it's much more of a disinfectant. It's not an antiseptic. The residue in the skin is nasty. You wouldn't want that to have anything on that to do with it, so to speak. All right? And again, the only time you really have to have sustained use, and there's not a lot of things that can do well with sustained use. The big mistake, if you're at home and you're going to use that, if you have something in stainless steel, don't use it. It will tarnish your stainless steel. And that's all. I mean, you might have kitchen appliances, you might have pots and pans. Be very careful with that because it will tarnish it. And that's not a good thing because eventually that's on the road to being problems with it. So the other one is iodine. The problem with iodine is it's not a sterilant, and in fact, in my way of thinking, it's really not a disinfectant. It has been erroneously classified as that. For years, we had tincture of iodine. There's a little bottle with skull and crossbone poison, and it stung like anything. Moms used to chase us around when we were little kids because of the alcohol and the iodine together. If you fell and scraped your knee, and moms were, because, oh my God, it's going to hurt. I don't want the iodine. Honest to goodness, the trouble was that combination released the iodine very, very rapidly. And so they developed something called an iodophore. They had a protein carrier molecule called povidone, Povidone. And they put that together with the iodine and magically betadine. And betadine's great. It's another one of those, when you add soap to it, it works even better. So, and you can use iodine, you can use the betadine or whatever the generic form is directly on the skin. That's what you prep with in surgery, the vast majority of the times. The only time you don't prep with it in surgery is if someone's allergic to it. If someone's allergic to that, people have for the days used to prep with an old agent we're going to get to called tincture of methylate. Sometimes a metal, some people are allergic to that. Here's a little tip. You can impress the people in nursing when they say, what do we prep with the skin in surgery if they're allergic to betadine and to methylate? You ready? Tincture of green soap. TGS. I have used that. I used to keep a big bottle of that in my office just in case. And about that, if I did 500 surgeries, maybe once or twice I had to use that. It's that Boy Scout thing, which I wasn't. Be prepared. I told you, my best friend was an Eagle Scout. I had all that covered. Go camping with an Eagle Scout, you never get into trouble. People would flock to our fires when we went camping. Because I got it covered. I had no idea what I was doing. So it released the iodine more slowly. Good news and bad news. If you dilute it, it's still effective because the soap form is diluted. It works more or less as effectively as the chlorhexidine. It's a matter of preference. I like the chlorhexidine a little bit. I think it's a little kinder to your skin. People make a mistake. This is another one of those things. Don't tell the nursing people. A lot of what we used to do years ago when we would operate, we'd put iodine directly on. We would put iodine directly on healing wounds. We call them betadine wet to dries. They're criminal as far as I'm concerned. You'd impregnate gauze with iodine and you lay it right on a wound, and then, we'll just peel it off and it'll help to debride the wound. In other words, it'll remove some of the yuck from the wound. All that did was irritate it more and more. Iodine full strength like this, betadine full strength, is tissue toxic. If you want to use it for wound care, dilute it 1 to 10. Put an ounce in a pint, it'll be fine. That's what, and the same thing, ladies and gentlemen, for peroxide as well. A lot of that stuff is not appropriate for wound care. I know a lot about wound care, and that's a big mistake. They used to want wounds to dry out. We don't want that anymore. We want wounds to stay moist. We use ointments, we use agents to keep them moist. They heal better when they're moist. When they dry, those new baby cells that are being born die. You don't want to be tearing them off. I mean, that's torture for those poor cells. And as you can see, in stock solutions of this, that crusty stuff you see in the lab with the stains, you see that in iodine as well. And you see that in betadine as well. And what happens is Pseudomonas, a nasty, nasty bacteria that we do utilize in the lab. Okay? But when it gets in wounds, when it gets on burns, when it gets in diabetics, it's a big player. The trouble is you've got to be careful with that. So you got to make sure when you're taking that out, when you're pouring it out, you're not getting Pseudomonas on there inadvertently. So make sure that top of the container is cleaned out sufficiently, because that's really where it hides. And here are the metals. For years we used metals. Cavities were filled with gold, too expensive. Silver, too expensive. My age, my parents' age, they had gold sometimes in their teeth. Not because they were wealthy, because the gold retarded infection. Metals are very, very effective because they denature proteins. For years, when babies were born, now we use antibiotic drops. We use silver nitrate, something you might have worked with in high school in chemistry. What it does, if you get it on your skin, it turns it black. It'll go away. It's not a problem. Very disconcerting. I used to put it in the baby's eye. New parents would see their baby with these big black eyes and go, "Oh my God!" It would disappear. It was hard to explain to them. We put liquid silver nitrate because it was killing gonorrhea. It's mandatory, if you did not know, when a baby is born, to use antibiotic drops in their eyes for that very reason, not just for gonorrhea, for chlamydia, for a variety of things. So understand that that's mandatory. Whether or not there's any evidence of any type of infection like that or not. And depending on the infection, there's different protocols that have to be observed. So they're very toxic, and so we use them. Remember I told you there's one product we all use it. I'll tell you the product. Topical care of burns. Silvadene cream. That contains silver and contains a sulfa drug agent, which we're going to get to when we talk about antibiotics. So it's actually silver sulfadiazine is the name of it. The trade name is Silvadene cream. Everybody uses it to treat burns topical. Like I said, if there's something really good, we all use it. That's one that stood the test of time. There were about 3 or 4 of them that were utilized for burns back when I learned about this stuff in the mid 70s. Now we just use Silvertine. And so, and this is where we get into them. They're very, very strictly regulated. We had something called tincture of merthiolate, a mercury compound. The mercuric compound we worry about, and what that study was vis-a-vis the autism, was thimerosal. I believe it's spelled Thimerosal. So you want, now if you got a flu shot, probably had thimerosal. For adults, it's fine. I mean, mercury is a neurotoxin. For you and I as adults, you'd probably get more mercury if you go Friday night to your local fish fry. That's why I love this time of year. Fish fries, baby. The Jewish guys going to the churches, they got some good fish fries. Fish fries, French fries, bread. It's a carbohydrate addict's delight. Love that. I can't get enough of that. Oh, Pittsburgh is, they've got great fish sandwiches here. Years ago, the Codfather. Don't like fish fries? So much tartar sauce, so little time. I make my own. Okay? So that's the nugget. So we don't use them that much anymore today. These if you wonder what happened with teeth, they changed to what they call semi-precious metal alloys. They use metals, and now that metal may be part, but the coating is different because now we're much more. Cosmetic dentistry has grown leaps and bounds and become a lot more affordable, depending on what you're going to do. I mean, you can spend a lot of money here. Because my daughter, did I tell you that? Before the wedding, she went to Columbia, as in country of destination dentistry, to have like $5,000 worth of dental work done before the wedding, which would have cost, she's still at $30,000 or $40,000 in this country to offset her or my granddaughter going to Columbia for a trip. I mean, let's say I was a little concerned about their drive from the airport 40 minutes to. I digress. She's aged me a lot. Ozone. So these, again, toxic derivatives of oxygen. It's used a lot in drinking and wastewater. It's not something you would use, but you should be aware of it. So ozone is one of these, it's sort of an oddball of oxygen-based gas. And here's a really important category for oxygens. This is hydrogen peroxide. It's not the only one, but it's the most important one because we use it all the time. It is used This is the big deal. Readily biodegradable, no residue. If you go, a lot of gyms will have, I mean, people are exercising, they're breathing heavily. You're going to see the agents that they're wiping down the equipment with are generally biodegradable or user-friendly in that regard. First one I went to years ago used a combination of peroxide, good old hydrogen peroxide out of the bottle, and orange oil, something that's very, very popular in laundry detergents because it's very effective at breaking things up. But it's totally environmentally friendly. So you spray the equipment. And that first gym I went to had a silver sneakers program. That means they made that. If you had UPMC and you retired from them, you got a gym membership. So I mean, I was like a kid there. Most of the people were well into their 70s, much older than I was at that time. When I first started going to the gym. So much less toxic than ethylene oxide, much less toxic glutaraldehyde. And this is the idea when I talked about the ultra high temperature method. Vapor phase hydrogen peroxide is so potent that if we superheat it to about 140 degrees Celsius, in 3 or 4 seconds, it will sterilize those interior of those containers, be it a juice box, be it a container designed for dairy. You can go to the store now and get almond milk. If you go like we did, if you go in Mexico, you're going to see all of those are stored in effectively juice box type cartons, and they don't necessarily have them refrigerated. It just so happened when the resort we have, they had them in the container with refrigeration. They don't require it. It shocks people. We are in love with refrigeration. You have to refrigerate it once you open it. But if you go to Europe, they don't have that giant side-by-side mega refrigerator that a lot of us have, okay, with the French doors and the giant freezer. They don't. They have your dorm refrigerator at best, because refrigeration is not trusted. Things are left at room, eggs are at room temperature, just as we wash up. I mean, it may surprise you. It's different in different countries that are there. So that's just the way it is. And the reason is how they shop. They shop daily or every other day. And they go to the market every day. And then and it's not that they don't make a recipe. They go and see, oh, what looks good today? And they make the recipe to what looks good. It's not like, oh, I'm going to make this mushroom recipe and the mushrooms look sketchy. They're not making that. Just the way it is. So understand there's different cultures. It's different than we have with mega marts today and giant refrigerators. So part of that, hydrogen peroxide depends on the surface. You're going to do the catalase test in lab. Catalase is in all of our cells. It's one of those peroxide. Remember, we had different cells that had different things that were in them. So had catalase and superoxide dismutase. We have lysosomes. We have peroxisomes. Those were the cells. And the fact when tissue is disrupted, it releases catalase that rapidly breaks down hydrogen peroxide into water and hydrogen gas. Yes, it's better on inanimate objects, but if you dilute it, and then you buy 3%, by the way, in the store, notice that also comes in an opaque bottle, no clear bottles. That's really very, very helpful. Okay, and so that vapor phase is a sterilant. This peracetic acid is something that can also use as a sterilant. Notice it even worked with organic compounds. So, and the fact that it doesn't leave a residue. So peroxide is very, very useful. There's nothing wrong with using it at home, but understand when you use it full strength out of the bottle, it stinks. And if it's an open wound, I always would dilute it. I tell patients we can use on this wound healing, just like betadine. Take an ounce or so of peroxide out of the bottle, go get some distilled water, put that in a clean jar, about a pint of the distilled water, and use that. Wasting your gauze pads with that and clean up. The same thing with betadine. We have them diluted. It's very effective when you dilute it. Otherwise than that, it's cytotoxic. We were learning about that stuff. They were doing studies at Harvard. Someone he wasn't a resident under me, he was 2 years behind me. I mean, he did a residency up at New England Deaconess Medical Center, which is a branch of Harvard University's hospital. And I mean, he did a whole study on peroxides and betadines and presented. It was very, very interesting in wound care. So this, historically, very important. Phenolic compounds is what Lister used. Why don't we use them today? We don't use them today because over time we have found that there tends to be systemic absorption. We don't use them in soaps. For years, the antibacterial soaps contained agents, and this is the one, triclosan. 10 years ago, every antibacterial soap had triclosan as the active ingredient. Then they started to find increased levels post-mortem in tissue, like liver, like kidney. And it was like, wait a minute, I wonder what this is doing. And they took them away. There's good news and bad news. Phenol is something that organic chemistry students learn about. It's called carbolic. There should be an L there. And basically, yes, it's nasty. You couldn't use it straight in the skin. It burns. We used to use it to cauterize. But if you dilute it, which Lister did, it becomes a very useful agent to cleanse skin, to cleanse instruments, to wash one's hands with. And he did all of those things when he instituted his principles following the work of Pasteur that we discussed in England. Okay, and yeah, it destroys membranes and denatures proteins, not reliable on all viruses, but it was and he reduced infection rates dramatically. It's very cost effective. Yes, it had some degree of a residue, and a lot of times when interestingly enough, there's a concentration you could actually use as a local anesthetic if people were allergic to local anesthetics. The problem is these two agents, when I was a kid, a lot of medicated ointments had hexachlorophene. They took that off the market because it had neurotoxicity. And then the triclosan. And that was in mouth care products, and mouthwashes, and skin care products, as well as antibacterial soap. So it's important historically, and for years it was the active agent in Listerine for mouthwash. And so, but now we don't use it as much. It's been replaced by these, which are called the quats or quaternary ammonium salts. We'll start with that on Friday. So thanks a lot for joining me here today. Those of you who are able to come to the party.